I'm delighted to present you with the following conversation with Colin Nunan. He's a scientific advisor for the Alliance to Save Our Antibiotics. It's an alliance of health, medical, environmental and animal welfare groups working to stop the overuse of antibiotics in livestock farming. It's a really interesting conversation. I stumbled upon him or upon his work while doing research for a chapter on antibiotics, and basically his work blew my socks off because it was just so well thought out, so deep, so realistic and pragmatic, that I had to chase him down. So really wanted to talk to him. We talked a few months back, and then unfortunately my recording was deleted. I only had 6 minutes of a recording afterwards, so unfortunately that happened, and now we finally got to do it again, which I'm delighted about. And we talk a lot about antibiotics in supermarkets at the beginning, and what he's working on. But if you want to skip past that part, it's about 20 minutes in, we discuss what AMR is, antimicrobial resistance, which is all over the world right now, and it's a massive threat to us. We're all developing resistance. When we get sick or when we're in the hospital, we're relying on antibiotics that are getting used up more and more. We're developing resistance, and apparently only 50% of antibiotics work on us now. So it's a huge issue for us. It's also a huge issue for animal welfare and the protection of the environment. It's one of the big drivers of factory farms, and it's a huge threat because it creates superbugs. So it's very interesting to hear a guy like Colin, who's developed a global overview, and really looked into these things in depth in each country, and just understanding the mechanics of it. So without further ado, here's my conversation with Colin Nunan. I'm going to link the TED Talk he's done in the description below, and maybe a few other details about him. And enjoy. Take care.
Colin, hey,
Hi,
how
how
are
are
you?
you? Yeah, I'm
Good, and
good. How are you?
yourself? Not too bad. Lovely to see you again,
Yeah.
and hopefully this time will run a bit smoother than last time.
Yeah. Yeah.
How are you getting on? I've actually switched applications since, because I just don't trust Teams anymore, or the laptop. So I'm that paranoid that I've put it on the phone, to
Okay.
make sure that I don't lose the recording again.
Okay. Okay. Good.
Yeah. How have you been?
Yeah, fine.
Busy?
Been very busy. We launched a new report last week. So yeah, got some good media coverage. So yeah, it's good.
Very good. What was the report about?
It was about the antibiotics policies, supermarkets antibiotics policies. Every few years every couple of years, I suppose, for the last 7 or 8 years, we've been doing a report on supermarket antibiotics policies and trying to encourage them to have strong policies.
Yeah.
And so that was about that.
So that effectively means they're stopping buying stuff with high antibiotic use in the back on it,
Well, that's
the
what we
products.
try to encourage them to do. Yeah. So, I
Right.
mean, um, and we've had some success with it. It's kind
Good.
of improved over the years, but um, their policies apply mainly to sort of own brand products, and um, they don't
Okay.
they don't apply to branded products. So so
Is
yeah.
because they have more control over their own
Yeah,
stuff.
yeah,
Yeah.
yeah, exactly.
Yeah.
Yeah, yeah.
Yeah. It's tricky.
So it's it is more difficult for them to be checking stuff that's not. But then on the other hand, it is feasible. Like there are some, like Marks and Spencer's doesn't sell branded stuff. It's branded
Right. Yeah.
animal products. They do sell some brands, but they don't sell branded animal products.
Yeah.
So they're able to control all of their animal products. Whereas, if you're selling branded meat or that sort of thing, well, I mean, in a way, it's their responsibility. They're very powerful still, so
True.
they can still choose, they can say to their brands, well, do you have a policy? Are you doing this or not? And of course, a lot of them are not. But anyway, so that's what the yeah.
And Colleen, before I forget it, are any of them standing out that are doing very well? Or
So the ones,
very obliging?
well, the ones that we found are doing the best. Marks and Spencer is doing the best.
All right.
Then
Okay.
then followed by Waitrose and Tesco. Then after that, you're down to sort of Sainsbury's, Morrison's, Co-op, and then sort of some of the weaker ones are kind of Lidl and Aldi and Asda, and Iceland is very poor. Yeah, so yeah.
So these are all European
They're all
operators.
British, British.
Okay.
Well, because
Right.
Aldi and Lidl, they have supermarkets in Britain now. Well, they have them in Ireland.
Yeah. Oh, they're
Yeah,
literally everywhere.
yeah. I mean, they're obviously European owned, but they're major retailers in Britain. So,
Yeah.
yeah.
Do you see any of that happening anywhere else on the continent or in the world where, the way you have quite a global view or an understanding of what's going on around the world, do you see the similar actions or
Yeah,
whatever developments happening?
well, one thing that kind of inspired our decision a number of years ago to start doing these reports looking at supermarkets was that in the United States, campaigners there had published kind of a series of reports called Chain Reaction, and where they were looking at essentially the antibiotics policies of restaurant chains, fast food chains.
Right.
Because
Yeah. Another big one.
yeah, so in Britain, like supermarkets are very much the dominant buyers, but in America, people eat so much in McDonald's and places
That's good. Yeah.
that they are actually major
Interesting.
marketers. So
Yeah.
they really focused on the restaurant chains, and in particular, they started off by focusing on chicken. And that actually resulted in a very large reduction in antibiotic use in chicken in the United States, but not in other species.
Right.
And so they had this kind of success in a way. And so we thought, well, we should try doing that here. So, but I don't think anyone has done supermarkets in the same way as we've kind of done it in other countries. I mean, that's not to say that supermarkets haven't been taking initiatives in other countries, because they have. But yeah, our series of supermarket reports has, in my view, definitely had an effect on antibiotic use in the UK, because the method, the way that we analyze it is we write to them and we tell them we're doing this analysis, and we sort of offer to speak to them and have meetings with them. We end up having meetings with some of them, but we tell them that the assessment is not going to be based upon what they tell us they're doing, but what is actually published on their websites about their antibiotics policy. So it's all the assessment is based upon publicly available
And are they
antibiotics policies. And essentially, we look,
yeah.
no,
Are they
essentially we look at those.
disclosing? Sorry, there was
Well, some of them
drop
are,
in the internet.
yeah. So originally, some of them weren't. When we started this, now most of them have something on. Well, pretty much all of them have something on their website. But some of it's quite detailed, some of it isn't. But essentially, what we do is we have a series of questions about, how clear is the policy? Does it set out what the policy applies to, like own brand, branded, UK production, imported, all that sort of thing. And then we have a series of questions like, does it restrict the use of the highest priority critically important antibiotics? Do they collect data on their suppliers' antibiotic use? Do they publish data on their suppliers' antibiotic use? Do they set targets for reducing antibiotic use? Do they have good animal husbandry policies aimed at reducing animal disease so as to minimize the use of antibiotics? These sorts of questions. And essentially, we just look at the policy and we kind of give them ticks or crosses, or like green or red,
scoring
green,
system,
red, or amber, and then we publish it. Now, for example, Iceland is one that has never kind of responded to any of our letters. They've never come to webinar that we've organized for supermarkets, or come, been on a conference call or anything. But they reacted to our latest report by saying, they are misrepresenting our policy. We have policies that we use with our suppliers that do X, Y, Z. But of course, none of that is on their website.
Right.
They kind of say that they choose not to publish these policies. And so, we say, well, sorry, our assessment is based on what you published. And in our view, the consumer has the right to know what your policies are. And if you're not publishing them, then so be it. We're going to criticize you for not publishing those policies.
It's the same blueprint in almost everything, isn't it? The disclosure is the name of the game. I mean, sorry, I worked in investment management, and I know that, just say, private equity doesn't disclose much at all. You have no idea what they're doing in the background. So that's why it has such a dark reputation, because it doesn't disclose anything. Whereas if you look at other institutional investors, they're more upfront about it, or publicly traded companies. They allow you to see more into their operations, and it's obviously a bit shady anywhere if someone says, no, we're not going to give you any data, or not even any hints. So I'm just thinking as well, if those supermarkets buy stuff from unregulated countries who aren't playing ball either, that, like, say Iceland is the supermarkets you're talking to, but say the providers of produce, meat, dairy, everything, food, a lot of them aren't coming to the table at all, or not even a lot, but a few major players, where anything goes in their country, right? They're not coming to the table at all. Do you see, if you shine a spotlight on, say, the supermarkets or the fast food chains, and you, if they feel like they're coming under pressure, and possibly public pressure as well, because I've made a mental note now of the ones that are playing ball, say Marks and Spencer's, I'll automatically go, oh, they're willing to play. So I keep saying play ball, but they're willing to come to the table and to even accept that this is an issue. Whereas if the supermarkets and the fast food chains are not playing ball, well, then I'll maybe take my business elsewhere. Yeah,
Yeah,
that's the power of voting with your wallet
yeah,
and all that
yeah,
stuff.
yeah, yeah.
Um, are any of those, sorry, this is a long question. Are any of those supermarkets or fast, say, let's focus supermarkets, are they stopping buying off certain countries or, that are also not playing ball? Or is it
Yeah,
kind of
well,
a line that if you're not disclosing
yeah,
stuff as a supermarket, you're probably getting it off a country that's not disclosing it either?
yeah, yeah.
And
Well, so as I say, most of the supermarkets are only applying it to their own brand products. So from that point of view, they're not really doing anything on the branded products yet. I mean, Waitrose do sell branded products, and they say that they are trying to extend their policy to branded products, which is more than what other supermarkets say. At the moment, the other supermarkets just don't really mention these other
right,
um, things. Iceland, funnily enough, actually goes as far as saying that its policy applies to everything that it sells. But clearly, we find that very hard to believe because there's like literally their policy is just 4 lines long, whereas other supermarkets are have policies that go sometimes pages.
they've really thought about it,
Yeah,
dedicated
yeah, yeah.
resources
They've
to it, taking it
um,
seriously. Yeah,
yeah, like a lot of the supermarkets, Marks and Spencer's, Co-op, Sainsbury's, Tesco, um, Waitrose, uh, Morrison's, they have policies that go into pages and go into quite a lot of detail about what they're doing, or at least
mm,
trying to do. And so they're more believable, really. Um, but yeah, so a lot of what is imported into the UK is imported from the EU. So in theory, it should be properly regulated. However,
mm,
we do know that within the EU that there are countries that have been massively overusing antibiotics, seemingly not fully in line with regulations, perhaps, but certainly very very high use, like places like Poland or
right.
Spain or Italy, um,
Okay.
and
So
yeah, and so
apologies. No.
yeah, so some of those supermarkets, so for example, there has been a Polish chicken scandal where uh, there has been the importation by various supermarkets, including Asda, Lidl, and Iceland, of lots of Polish chicken, which has high levels, well, has been associated with major outbreaks of antibiotic-resistant salmonella, um, and
Right.
caused deaths in the UK and this sort of thing. But it's also been causing outbreaks all over Europe, um,
Jeez.
and so yeah, so there is a case of you know you say that you're ensuring that Iceland say that they're ensuring that all their suppliers don't use antibiotics routinely, but you're importing this stuff from Poland where it's very clear that there's been routine antibiotic use. So how is your policy credible?
Yeah.
uh, but then there are like some of the supermarkets are also importing for their own brand products. So, for example, they might be selling, I don't know, own brand Parma ham or something like that. They are importing products for, uh, for their own brands. And say Tesco, for instance, does apply their policy fully to those imported products for the own brand, and they are actually collecting data on the antibiotic use, say, of their Italian suppliers of pig products. They are
Hmm.
collecting and they are publishing it. So it kind of depends on the supermarket, but some of them are surprisingly doing quite a bit, really. And
Very good.
overall, we think that it has contributed to reductions in UK farm antibiotic use. In particular, there are certain antibiotics that are particularly important in human medicine that are used in farming, which are called the highest priority, critically important antibiotics. And we, from the beginning, have been asking, analyzing supermarket policies to see if they have specific restrictions on the use of these antibiotics. We're not calling for an outright ban, but we're calling for them to only be used as an absolute last resort. And most supermarkets now have those restrictions, and we believe that has actually led Red Tractor, because the issue that supermarkets have is if they want to introduce, say, restrictions on these use of these antibiotics, they also, it obviously works easier for them if the farmer is certified by some assurance scheme, and that assurance scheme has a restriction on those antibiotics, rather than the supermarket itself having to fully verify everything. If the assurance scheme, if they are already in an assurance scheme, like say Red Tractor, then if Red Tractor has restrictions on the highest priority, critically important, then the supermarket can, and they're buying from Red Tractor, they can know that's
easier. Yeah,
that's easier. So the fact that we put the supermarkets under pressure to have these restrictions, I believe, has led supermarkets to then say to Red Tractor, "Can you put these restrictions in place?" And in the last, or this is what I'm imagining and has happened. I don't know this for sure, but what has happened anyway is that in the last few years, Red Tractor has put these restrictions in place. And as a direct result, after years of increasing use of these antibiotics, in the last few years, the use of the highest priority, critically important, has fallen by over 80%. So there's been a big reduction. So I do think that the supermarket actions, because they are the biggest buyers, we have no way of checking the policies to see to what extent they're actually applied. That we don't pretend to be doing that. We are literally just looking at the policies online and assessing them. But the amount of detail in some of the policies, the fact that they are publishing, some of them, a lot of them are not publishing data, but some of them are, believe does show that it's not just, for some of them anyway, it's not just words on paper. It
sounds credible.
It is credible, and it has had an effect. We don't believe that voluntary action is the solution. We're very much in favor of regulation as well, but I think clearly that this action has definitely helped.
Brilliant. I mean, you're touching on a good point about regulation. It's the same with every environmental thing or about climate change, the big PR campaigns that the COP would be every year, but to actually make sure that the promises are upheld, that it's not just a law, but a proper regulation where, people actually do it. I always think of Napster and all these downloading things in the past where you download there'd be a law that you can't do it, but at least in Ireland everyone was using Napster to download loads of songs, even though it was illegal and no one enforced it. So definitely regulation is very important and not just laws. Yeah, I wish I had started this off a bit differently, because we went straight into the supermarkets, which is so interesting that I couldn't not talk about it. And thanks very much for the update on that. If we ever speak again, I'll be asking how it's going. I guess because this is for a viewer that might not know about antibiotic resistance, or AMR, as they call it, antimicrobial resistance, maybe we could just start off at the top to just explain it, because quite honestly, while now I'm deep into this stuff, or quite deep into it, I wasn't aware of it that it was such a big issue. It went completely over my head, completely. And while doing research for a book I'm trying to write, I went, oh Jesus, this is actually huge. This is huge. It literally, yeah, I was completely unaware of it. And then when I talked to friends or family or people I worked with, you know, a lot of them would come back with, we're trying to reduce antibiotics, and they'd say, but we need antibiotics. And I go, that's where the level of understanding for a lot of, at least the people I know, are at. So, you know, and that's exactly the point. It's because we need antibiotics, or one of the points. It's because we need antibiotics that we're trying to tackle the issue so that we don't
Yeah.
we have them for when we're sick. And of course we'll go into the animal side of things, but that's the issue, and it's global. So, and I just rewatched your TED talk on it, just to kind of refresh as well. But it sends kind of a chill down your spine when you realize the gravity of the situation, that it's really, it's something we're kind of brushing under the carpet, or at least mentally. A lot of people have not registered it because there's so many other things going on in the world. You know, we have, and now with wars, and you have these like creeping, sneaky, creeping fundamental things that are so important to our existence, the environment, to animal health, and um, it's like there's too much going on that we're not paying attention to the fundamental things that keep all of us healthy and existing with a good quality of life, including environment and animals. So sorry, it's a long-winded way of saying let's talk about what it is first.
Yeah, yeah.
Yeah, I don't
Well,
know. Do you
well,
have anything to add?
yeah. So, I mean, you know, antibiotics are particularly important medicines that, of course, are used in human medicine for treating bacterial infections. They're also really important for preventing bacterial infections that people might need to take, for instance, if they're undergoing surgery, where there's a risk that any part of the body that is cut open might become infected. So the use of antibiotics can be very important for enabling surgery to go ahead. Antibiotics are important for people undergoing cancer chemotherapy because their immune systems are weakened. And so antibiotics are really sort of an important foundation for a lot of modern medicine. And, you know, we've been using antibiotics in human medicine sort of since the sort of mid sort of 1940s. And it's really had a major impact on, you know, extending life expectancy and on reducing deaths from infectious disease. But the problem with antibiotics is that if you overuse them, then bacteria are very good at evolving resistance to antibiotics. Bacteria reproduce really, really quickly, and they have methods for evolving quite quickly. Not only can they evolve when they reproduce, they can actually exchange genes between each other. And so they are very clever at evolving. And so when the bacteria are surrounded by antibiotics, or they evolve to resist them so that they no longer are killed by the antibiotics. And so we've known about antibiotic resistance since the beginning of the antibiotic era, but even though people have been warning about this right from the beginning, saying do not overuse antibiotics because they will ultimately then lose their power, and then we will struggle to treat infectious disease. So even though that there was this warning from the beginning, at the same time, once we had figured out how to produce antibiotics, we began searching for more of them, because antibiotics, most of them are naturally occurring chemicals that are produced by various microorganisms. So people began searching for more antibiotics from, say, soil microorganisms and this sort of thing. And they started finding more antibiotics. So even though when right from the beginning we started overusing antibiotics and antibiotic resistance began appearing, just as some scientists had been warning would happen, people often weren't that worried because new antibiotics were being discovered. And so we were still able, so certain antibiotics started losing their power, but we had other ones. And so we just switched to the next antibiotic. And that worked fine for decades in a way. But the problem was that eventually we stopped discovering many new antibiotics. Now, we are still discovering some new antibiotics, but actually, for many infections, we have discovered no genuinely new antibiotics for over 40 years. Brilliant. And so what that means is that, initially when we stopped discovering new antibiotics for many infections like E. coli or many of the food poisoning infections, again, people were worried, but they weren't so worried in the sense that we had reserve antibiotics. We had previously discovered antibiotics that we knew worked for treating these diseases, and we weren't using them yet. We still had new
something that's in the arsenal.
Yeah. But this century, so then after about, there comes a point then when the ones that you're using, the resistance becomes too high, or, particularly for life-threatening infections. So like we have antibiotics that still work very well, but if you have 10 or 15% of the bacteria that are resistant, if your infection is not life-threatening, well, that's still a good antibiotic to use, okay? There's still 80 to 80% chance it's going to work, and you're not yet, your life is not in danger, you're sick, you might be even quite sick, but your life is not in danger, so you use that antibiotic. But if a patient is at the stage where their life is in danger, is it still ethical to use an antibiotic that has 10-15% chance of total failure when that there is a reserve antibiotic which has 0% resistance at this stage? So at a certain point, once you get to a certain point, you then have to start using reserve antibiotics, because it's
right.
It's not acceptable to be using antibiotics that don't have full efficacy. So in the 21st century, we began using these reserve antibiotics. And once we began using them, we began seeing resistance emerge. So now we are at the stage where there are two essentially broad categories of bacteria called gram-positive and gram-negative. And for gram-negative bacteria, we have had no genuinely new antibiotics for over 40 years, and we've also begun that have been discovered, and we've also begun using our reserve antibiotics. So we have no reserve antibiotics left. So everything that we have ever discovered is now essentially in use.
Right.
There are no really promising prospects right now that, in the next few years we may discover some eventually, but right now nobody is saying there's brand new class of antibiotics that's going to be introduced. new antibiotics that work against gram-negative bacteria are being discovered, but they need to be effective in a human. They need to also not be toxic to a human. They need to be able to distribute properly in the body to actually get to the infection site. And they need to also be genuinely better than anything that is already in use. And so these kinds of, so there are, some antibiotics that get discovered, but ultimately during the process of testing, eventually, what gets introduced may not be any better than anything that's already there. In particular, if they're already related to existing antibiotics, then the chances are that there will already be resistance to these antibiotics. So the key thing then really for preserving antibiotics for when they're really needed is to not overuse antibiotic. Mm-hmm. We may discover new ones, but the fact is, for gram-positive bacteria, we are still discovering new ones, but for gram-negatives, we have been unsuccessful for over 40 years. And so it's a case of not overusing antibiotics. Now, a lot of resistance to antibiotics in human infections comes from the human use of antibiotics, but some of it ultimately comes from the farm use of antibiotics. So what can happen if you use antibiotics in farming is that bacteria can become resistant. Not only the bacteria that maybe are infecting the animal, but the animal may also have other bacteria or will have other bacteria in their guts, and some of those bacteria will also become resistant if the animal is being fed antibiotics, for instance, in animal feed or in its drinking water. And then when the animal is slaughtered, the guts, the intestines are sort of removed from the carcass, and there's inevitably contamination that occurs, and some of the bacteria end up on the carcass and ultimately on the meat, and then those bacteria can be passed on to humans when they kind of handle the meat or eat maybe undercooked meat, because usually if the meat is properly cooked, this will kill off the bacteria, although some bacteria also produce spores, and those spores are not necessarily killed by cooking. So that's particularly for Clostridium difficile. But generally, the bacteria are killed by cooking, but people have to handle the meat before they cook it. And the reality is sometimes meat is not properly cooked, including sometimes if you eat out or people sometimes it's not properly cooked and people do become infected. There is also the possibility that bacteria transmit through the environment, so that a lot of the antibiotics go straight through the animal, end up in the manure. Antibiotic resistant bacteria end up on the manure that gets spread on land. Sometimes it may contaminate water supplies, but it can also ultimately if that manure is not fully composted, those bacteria can end up on plants which you might eat, and of course some fruits and vegetables and that sort of thing are eaten raw. So there is a possibility of transmission in that way. There is also the possibility of transmission just by contacting the animals. So farmers are definitely at far greater risk of acquiring resistant bacteria from their animals than sort of members of the general public. And the bacteria themselves can end up in the air, particularly if you have an intensive farm where you have lots of animals kept in a small environment. And obviously there is air, going into the sheds and air coming out of the
Yeah.
sheds, and that air can have bacteria in it, and that can spread in the local environment. So we know that the overuse of antibiotics in farming leads to antibiotic resistant bacteria. It leads to the spread of antibiotic residues of the actual antibiotic itself in the environment. And we know that this can lead to spread of antibiotic resistance through the food chain, and it contributes to some resistant bacteria in humans. Worldwide, it's estimated that about 2/3 of all antibiotics are not used in humans, they're used in farm animals.
Mm-hmm.
Now, in some countries, that percent is a lot lower, but worldwide, that's the situation. So most spread of antibiotic resistance in the environment is actually down to farming, not down to human medicine, although human medicine can definitely contribute as well. And so that's why we need to be reducing the use of antibiotics in livestock.
Couple of thoughts. Thanks. First, it sounds like it's coming at us from all sides, no matter what, from the air, the water, the food. It's basically unescapable almost. No matter, even if you were smart in your choices of the products you buy and everything, it sounds like the resistance is just developing around you globally. It sounds like, because we're also interconnected, that it's
So
I could imagine in one of the countries where there's a lot of use of antibiotics in agriculture, that would increase the resistance in people that live there. Would that be right?
So I mean, obviously, so there are regulations, and it does kind of depend on the country as to how strong the regulations are, and also how well they are implemented. So like water supplies get treated, so in theory, you don't end up with antibiotic resistant bacteria in your tap water and that sort of thing. So but clearly on the food, there's no doubt that antibiotic resistant bacteria do end up, for example, on meat. We can do those tests, and that's absolutely proven. It will depend very much on the country as to how much resistant bacteria end up on meat, because some countries use antibiotics more responsibly than others. The environmental spread, how important that is quite difficult to determine. It definitely happens, but it has, on the one hand, been under-researched, but secondly, it's also very difficult to kind of prove because it's so kind of complicated.
Right.
We do know that antibiotics, most of them originate in the environment. They're naturally occurring substances, and so antibiotic resistance has been present in the environment for millions of years. Long before humans began using antibiotics, there were antibiotic-resistant bacteria because other microorganisms were already producing antibiotics in order to kill certain bacteria. So
right, naturally,
that has occurred naturally. The thing is, people have archives of soils, for instance, going back to the early 20th century in the pre-antibiotic era. And so they can now test soils that have never been exposed to human use of antibiotics.
Mm-hmm.
And then they can look in the antibiotic era, and they can now show that there has been a large increase in sort of agricultural soils that have been exposed to antibiotics, that there is now a far more antibiotic resistant bacteria in that soil than there used to be in the pre-antibiotic era. but it will depend on the individual as to what they do. So, for instance, if you are bathing in waters that have lots of antibiotic resistant bacteria, then yes, there is a greater chance you end up with antibiotic resistant bacteria. That's been proved for surfers, for instance. There's been people have looked at that. People who are surfing in a particular area where it is shown that there's more resistant bacteria, that they end up with more resistant bacteria. It's been proven for farmers, the direct contact with their animals, that definitely does lead to transmission. That doesn't necessarily mean that they become sick with those bacteria, because we've all got bacteria on us. And we've all got some of our bacteria will be antibiotic resistant, and we're not all sick. So, but if we do then become infected by some of those bacteria, then that infection will be antibiotic resistant. So it's kind of a probabilistic, situation. The more your bacteria are antibiotic resistant, then if you end up having a cut that becomes infected, there's a greater chance that it's going to end up being antibiotic resistant. Now, we also know that deaths from antibiotic resistance are on the rise, and worldwide, the most credible and large in detail estimate of the impact of antibiotic resistance is that 1.27 million people a year are dying directly because of antibiotic resistance, and that nearly 5 million deaths in total are in some sense associated with antibiotic resistance. These are really big figures when you consider that the COVID pandemic, over say that 3-year period, killed an estimated about 7 million people in total. So 1.27 million a year, and 5 million a year associated with antibiotic resistance. These are big numbers, and that's happening every year. Now, in some countries, the situation is much worse than in others, where antibiotics are poorly regulated. Some poorer countries have both problems of access to antibiotics, that people can't afford antibiotics, but at the same time, when antibiotics are being used, they're very often kind of just being used over the counter. So you just go in and you buy antibiotics, and they get
way too easily.
Yeah, way too easily. But also there are countries where antibiotics are manufactured, where there is poor regulation on the actual manufacturing of the antibiotics, and so a whole load of antibiotics get released from these factories into the environment, and that causes really high levels of antibiotic resistance in water that people are kind of using for doing their washing or bathing or that sort of thing. So yeah, the environmental spread is definitely an issue. It's not as easy to fully prove the extent, how exact, and it does depend on the country, but undoubtedly it's happening, and also we do know that through the food supply it's happening as well.
Amazing. I so many thoughts while you were talking. Definitely the idea of the poor regulation of antibiotics medically. Like, a neighbor of mine told me that his pharmacist, where he was doing a job for him, gave him antibiotics for a cold he had. And I thought, wow, okay, we still have those type of situations happening. I know someone who's doing a PhD on something in relation to antibiotics, and she said, sorry, this is from the medication side for the viewer, that they were being like if you pay for a trip to the GP, for instance, say like you do in Ireland, and you're a bit sick, you want something in exchange for the €50 you pay for your visit. So if your doctor gives you a clean bill of health and goes, no, you're fine, go home, you're grand. That's empty-handed. You go, damn it, no, hold on, I paid for this. I want something
Yeah,
to
yeah, yeah,
show that it was worthwhile me going. And so there are still some doctors out there, although awareness is rising, that they're actually still giving this stuff out for small stuff like flus and colds, and that's
yeah.
alarming.
Yeah, well,
Yeah,
I mean, it's not necessarily that flu is a small thing. I mean, flus can be, a bad infection, but the
yeah,
problem is it's a viral infection, and antibiotics work against bacteria, not against viruses. So, and obviously for a cold, it's also a viral infection, and so you don't want to be taking antibiotics. For some viral infections, there can be situations where you can have a secondary bacterial infection. So doctors have to consider that as well.
right,
But the thing that people need to remember as well is that, we all have bacteria in our guts, and these bacteria are doing good things for our health. And so
right,
if you if you have a cold and you take antibiotics, obviously it's not going to do any good for your cold. Your cold will just resolve itself anyway, and it's not going to do any good. It's actually going to be killing some of the good bacteria in your gut.
right,
Um,
yeah,
this it's also going to help create antibiotic resistance in your gut. So it's not, you may eventually feel fine, but the fact is now you may have a slight, you won't have as good gut bacteria as you
yeah.
previously had, and you may also have more antibiotic resistance. So it's definitely not a good idea. Um, you know, Doctors generally are, under a lot of pressure from, and it's not always easy um, to prescribe accurately. It's in many cases, uh, doctors may not exactly know because they may not exactly know what the infection is, because tests to determine that may take a few days, and this sort of thing. So it's not always easy to prescribe accurately. But
Hmm.
yes, there is also some, poor prescribing that happens, sometimes under pressure from patients.
Yeah,
It's good for patients to also know about this so that they don't put that pressure to prescribe poorly, because ultimately it's not doing them any good. It's in fact may, on balance, be harming them. So it's just not a good idea, and obviously it's not a good idea for society as a whole, because it creates more antibiotic resistance, and that ultimately, one person's overuse of antibiotics may ultimately lead to another person's antibiotic resistant infection, because
yeah,
bacteria spread from person to person. So if you overuse antibiotics, you may not end up getting that resistant infection, but somebody in contact with you may end up, because these
wow.
things spread and people touch each other, and people, are in contact with each other's breath, and that's, things spread. That's what,
Yeah,
that's how infections, survive. They go from person to person to person, animal to person, to, that sort of thing.
yeah,
So
everything. Yeah.
that's why it's
Um,
a societal issue. Yeah.
yeah, absolutely. You touched there on the gut microbiome, and I've heard that described as like our internal ecosystem, and the idea that the antibiotics are killing certain parts of our gut,
Yeah.
whatever they are, that leads to health issues as well, doesn't it?
Mm.
So
Yeah. I
that's
mean,
another concern on that side.
yeah,
Um,
yeah, yeah. So
do,
again, it's a very complicated issue, because we have so many different kind of microorganisms in our gut. We have
yeah,
bacteria, we have other types of microorganisms, and they're all interacting, and they all have their own particular niche inside there. But we do know that this is very important. Some of these bacteria are helping prevent certain infections. So, for instance, they may help prevent certain food poisoning infections like salmonella and make it more difficult for those salmonella bacteria to establish themselves in your gut. Because if you do eat some salmonella, some meat, say, that has some salmonella on it, you won't necessarily become infected. You need to have a certain amount of salmonella on it, but also those salmonella will need to be able to establish themselves in your gut and not just go straight through you. And so the better your sort of good bacteria are, the stronger they are, the more they're going to repel those salmonella, and you have better chances then of not becoming infected.
So,
but they do more than just provide this barrier against infection. They interact with many human processes. There's even evidence that having the right bacteria or having poor gut bacteria may be associated with becoming overweight, becoming obese, whereas if you have better bacteria, you will keep a more normal weight, or rather it's easier to keep a more normal weight. We know that in farming, for instance, that the use of antibiotics, one of the effects of that in farming has been to produce a growth promoting effect. This is one of the reasons that antibiotics have been used in farming for decades, although this particular use as growth promoters is banned in many countries now, and has been banned in the European Union since 2006. But up until 2006, you could use antibiotics as growth promoters, in the European Union, and you can still use them in some countries around the world as growth promoters. And essentially, the antibiotics would be altering the gut bacteria of the animal in a particular way, which resulted them in putting on more weight. Now, you have to realize that this would work.
Yeah.
Cattle, it would work in pigs, it would work in poultry, and fundamentally, the same kind of thing probably works in humans. Now, most humans are not taking antibiotics on a daily basis, but if you are, when we do take antibiotics, it does affect our gut bacteria, and if you're taking lots of them, it will have a greater effect. And there is evidence that effect on the gut bacteria actually results in putting on weight. So then there is even the evidence that it can affect people's mental health and this sort of thing, that our gut bacteria are interacting with our brain in a particular way. Now, I'm not an expert on all of these areas. As I say, it's quite a complicated area, but yes, having good gut bacteria is important. Yeah.
When you realize how big the subject is, I see some of the doctors on Instagram or wherever popping up about mental health, and the gut microbiome, and glyphosate, the main ingredient for Roundup, which is kind of in the news a lot lately, and a lot of lawsuits have been filed against Monsanto and won against them because, it shows that it's carcinogenic in many ways, and is an antibiotic apparently as well. Or it was tried to be an antibiotic, but it was, so you know this, but it was a bad antibiotic in the sense that it killed probably more than it should. Like, it wasn't able to zero in on the one thing. And a few doctors are saying that is really at our gut microbiome as well. And I've heard the exact same thing about the obesity and the mental health that that's that comes as a result of too much exposure to glyphosate. So have you any thoughts on glyphosate, or is that too far removed from
Yeah, I
what
mean,
you do?
it's kind of outside of my area of expertise, but yes, there is
Yeah.
certainly evidence that glyphosate and some other herbicides have antimicrobial effects. So, in other words, that whether they can kill certain microbes and they can kill some of them can kill certain bacteria, and so yes, there are concerns that the use of some of these herbicides can contribute to the spread of antimicrobial or antibiotic resistance in the environment. Because, as I've already mentioned, antibiotic resistance has existed in the environment for millions of years. But of course, if you are spreading a whole load of chemicals on
Mm.
fields that are having a selective effect, because what happens with antibiotics and other chemicals that have a kind of an antibiotic effect is that they, if there are already resistant bacteria there, then when you use the antibiotic or the chemical, it will kill off the ones that are sensitive, that are not resistant, and the
Mm.
resistant ones survive. And then they, of course, they now have more space, they have more access to nutrients because the sensitive ones have been killed off. And so they start spreading more. So the more you use them, the more you end up with antibiotic uh, resistance. So so yes, there are concerns about some of these herbicides. Again, some people are doing research into this, but yeah, I'm not an
Uh,
expert at that. But
That's absolutely fair enough. Thanks. So one big thing that's in my mental list to tick off is animal welfare,
yes,
which is probably, I'm assuming, is how you got into this mostly, because you really, like, you've immersed yourself in this world of antibiotics and agriculture, and it goes hand in hand with intensive farming, or factory farming as we many call it, and the impact the antibiotics has had on basically making a system uh, quite cruel, crueler than is actually imaginable. So it's you made a point in the TED Talk that antibiotics have been great for us, but they've been terrible for animals. Um, in the evolution of these intensive farming practices, and when we talk about the use of antibiotics, just I know a lot of farmers in my community. I, when we talk about antibiotics, I don't want to misunderstand that antibiotics are not to be used for veterinary purposes in single cases, unless there's a massive outbreak that's proven or whatever. It's we still need antibiotics for the event that animals get sick, say, but going into routine dosing and growth promotion, that's where the industrial nature of where farming has gone has obviously made everything a lot uh, crueler on animals, meat production and dairy if it's in the intensive side of things, and that's where these antibiotics have been used. This is the two-thirds of all antibiotics in the world are used in that. And I'm just, is for you one of the single biggest issues in animal welfare must be then handling how antibiotics are used in intensive farm and agriculture.
yes,
Sorry, big
yeah,
tangent, but yeah.
yeah. So yeah, so in human medicine, antibiotics are primarily used to treat infections, and as I've mentioned, sometimes they are also used to prevent infections. Uh, but overwhelmingly, antibiotics are used on a case-by-case basis in individuals. There are some very rare, cases where you may have an outbreak of a particular disease where you may need to give more than one person antibiotics at the same time in order to prevent a problem. But overwhelmingly, I think the vast majority of people would agree that they have taken antibiotics on an individual basis. And in farming, worldwide, it's overwhelmingly the opposite. The vast majority of antibiotics are given on a herd or flock basis. Of course,
Right.
also individual treatment of animals. And as a campaign group, we are not against the use of antibiotics in farming. And even though I do believe that overall the effect of using antibiotics in farming, because of the way they have been used, has been ultimately to make possible uh, intensive agriculture. And intensive agriculture does mean very often worse health for animals. So antibiotics have not improved animal health. They've overall made it worse.
Mm-hmm.
But in theory, antibiotics in farming can be used to improve animal health. And on some farms, they are used to improve animal health. And even in a very small number of countries, it can be argued that they are used to improve animal health because, there are, many farms which will be primarily using antibiotics on an individual basis to treat individual, say, cows or individual sheep. And on these, these are tend to be more extensive farms where the animals are kept outdoors. But in most European, not all of it, but in most European farming or a lot of farming around the world, antibiotics in pigs or in poultry or even in a lot of intensively farmed cattle and veal, antibiotics are used primarily in animal feed or in drinking water. They're used on a group basis. 85% of European antibiotic use is for group treatments. It's not for individual treatment.
Wow.
And as a result of feeding antibiotics on a group basis, it's possible to keep those animals much more intensively in much higher numbers indoors with no access to the outdoors. And essentially in conditions where it's much easier for disease to spread, but by using antibiotics and maybe also using vaccination and other types of medication, it's possible to keep the animals alive despite those intensive conditions. Now, if you were to put all of those animals in those intensive conditions and not be using some sort of medication, you would inevitably have outbreaks of infection, which would, result in far too many of the animals dying. But it also just means that the animals, even if they're not dying, they are, very often, nevertheless, suffering from some sort of health problems. They're also suffering from stress. And they very often don't have a very good quality of life. So the antibiotics ultimately have helped prop up these farming systems. Now, in the European Union and more recently in the UK, a new legislation has been introduced, which for the first time prohibits using antibiotics to compensate for inadequate husbandry, for bad hygiene, for poor farm management, and for a lack of animal care. So that, in theory, sounds really good. Well, in theory, it is really good, and it sounds very good on paper. Very good. The question is that being implemented? And because I mean, I would go as far as saying that we shouldn't be using medication generally for compensating for inadequate animal husbandry, poor hygiene, lack of animal care, poor farm management. But we do now have a law on antibiotics which says this. Now, in theory, that should mean that, for instance, if you have a shed with 30,000 chickens in it, and each of those chickens, which may weigh up to, say, 2 kilos when they're getting close to slaughter weight, has less than an A4 sheet of paper in terms of its space allowance. So it is really, really crowded.
Yeah.
They are all producing their droppings, and the shed is not being cleaned out because it gets cleaned out every when all the chickens are taken out for slaughter, but in the meantime it's not. Then obviously you have very bad hygiene. They are kept in for weeks. Obviously, it's completely obvious that is the definition of bad hygiene. And so under the law, in theory, that should mean you're not allowed to use antibiotics anymore for compensating for that bad hygiene. The bad hygiene under European law is totally legal. They may talk about good hygiene, but the law is clear. You're allowed to keep chickens in those conditions. But now the law says you're not allowed to use antibiotics to compensate for bad hygiene. Now, that law has only existed since 2022. And clearly, intensive chicken farming still exists, and, antibiotic use in intensive farming still exists. But then there are questions about, well, is this law being implemented? And, there are similar situations with pig farming, where we keep, pigs in very intensive conditions in many cases, and this is leading to health and welfare problems. It leads to very clear evidence of stress on the pigs, which stress is well known to be associated with worse immune system, and therefore more likely to lead to infection. We know that they're experiencing stress because they do things which they would not naturally do, like bite each other's tails, and as a result, they have tail docking of piglets. In theory, under European law, routine tail docking of piglets is illegal, but the vast majority of farms in Europe practice routine tail docking of piglets. The law is simply not applied. In some countries in Europe, that's not the case. So, some countries like Sweden or Norway or Finland, they don't allow tail docking of piglets, and they need to keep their piglets in less stressful conditions in order to avoid the tail biting. So, but we know that this is happening. And yes, the introduction of antibiotics to farming has been a major contributor to the intensification of farming that has occurred essentially since the 1950s. So throughout the antibiotic era. And, part of what we try to work towards is improving husbandry practices so that we reduce stress and reduce poor health and reduce the need for antibiotics. And we have argued very strongly in favor of, and we now have better regulation of the use of antibiotics, but that's only one side of the story. The other side of the story is to reduce the need for antibiotics. And in our view, the main way to do that is by improving animal husbandry, improving animal health. In some cases, that has occurred to to some degree, and depending on the country. But overall, we haven't seen major improvements in animal husbandry yet. It will be interesting to see going forward once, because the EU laws, which have restricted the use of antibiotics and have introduced this new law also. So there have been new laws in the European Union which say, for instance, you may no longer use antibiotics preventatively or prophylactically for group treatments. That's a new law which is introduced in January 2022. There have been new law saying you may not use antibiotics routinely. That's now the law. That never used to be the law. There is a law saying that you may not use antibiotics to compensate for inadequate animal husbandry and bad hygiene and lack of animal care. That's a new law. These all came into force in January 2022. We still don't have, so we will start to be getting, so we have seen some reduction. We did see some reduction in antibiotic use in 2022 in the European Union. But we don't yet have data on the use by species in most of Europe. But next year, we will get the first kind of EU-wide data on antibiotic use by animal species. So we will be able to then say compare antibiotic use in Swedish pigs with antibiotic use in Italian pigs and Spanish pigs and French pigs and that sort of thing. And we will start to see for the first time ever, because we already know that there are big differences between the countries, but we don't have enough detail where those differences are and why are there those differences. We know really, but in practice we know, but we don't have the data to prove it. To like some people say, well, prove it that antibiotic use is much higher in Spanish pigs than in Swedish pigs. Well, we know it is, but we don't have that actual hard data yet. We will have that data, and then from that point, we'll be able to say, wait a second, why is your use so much higher? Are you using antibiotics to compensate for your more intensive practices? So once we start to have that data, there will be new possibilities for campaigning and for putting pressure on practices to change. But at the moment, we're slightly still in limbo until we have some of that data. What we won't have next year is data by farming system. So data comparing, say, antibiotic use in organic pigs with antibiotic use in non-organic or intensive pigs. We won't have that data. We have some of this data exists to some extent in some countries, but generally speaking, we don't have that data. Where we do have that data, we see huge differences in antibiotic use.
Of course,
and with antibiotic use being lower in systems like organic, which have much stronger rules on animal husbandry than intensive farming does, where animals need access to the outdoors, particularly in countries like Britain and Ireland on organic, where stocking densities, the number of animals that you can have per surface area is much lower in organic farming, where various practices like tail docking are not permitted, where diets have to be different, because diet can have an effect on infection. It affects the gut, and a lot of antibiotic use is down to trying to correct gut problems, things like weaning age of piglets. If you wean later, the piglets tend to have much better gut health, and so they need fewer antibiotics to compensate. So all of these things can have a significant effect on antibiotic use. But overall, we need a lot more data on antibiotic use by farm system. But of course, there are people who don't want that data to be collected and published because it will show that their farming system is not doing very well. and so that's an issue. And unfortunately, we don't have this country by country data on antibiotic use by pharmacists.
Yeah. I mean, it is positive, I guess, that there is new legislation coming through. And if EU is kind of a model to go by for other parts of the world, it's probably inspiration for them and to show that it
It
can be
is,
done.
yeah. It has, for instance, the EU. Well, certain countries like Sweden banned
Scandinavian countries.
they banned the use of Sweden banned the use of antibiotic growth promoters in 1986. So that was 20 years before the EU. But the EU was the first. After that was really the first kind of significant block to ban the use of antibiotic growth promoters, which was finalized in 2006. Now, since then, other parts of the world have kind of followed the EU to some.
Slowly followed suit.
Yeah. So, like in America, in the United States, it happened in 2017. But we've had recently the United Nations General Assembly, and there was a high-level declaration on antimicrobial resistance that was published last week, or was endorsed last week, and this was the second ever high-level declaration from the United Nations General Assembly on antimicrobial resistance. And some people wanted for there to be a date, for instance, where we ban the use of antibiotic growth promoters globally, but there was, lobbyists and some countries, like including the United States and others, that have advocate. Well, I don't know if the United States actually was against that a date on growth promoters, but the fact is, there was in the declaration no date for banning antibiotic growth promoters. So antibiotic growth promoters can't continue. There's talk about phasing them out, but there's no actual date. So phasing them out, you could take another 100 years to phase them out. There's no date. It's quite incredible. There was also talk about setting a target for reducing global farm antibiotic use by 30% by 2030. That was kind of in original drafts of the high-level declaration. But countries like the United States and Canada, Australia and New Zealand, and also industry, some industry groups representing the pharmaceutical industry or intensive farming lobbied against this. And so there are no targets for reducing global farm antibiotic use that have been adopted. And I think this just goes to show that while there is greater awareness and this sort of thing, there are strong lobby groups that still winning out in many ways, that are opposed. They won't say we don't want farm antibiotic use to be reduced or to become more responsible, because obviously everyone knows that antibiotic resistance is an issue, but the reality is that some of their interests, their financial interests, would be challenged by reducing the use, because there is massive amount of overuse of antibiotics in farming globally. It is very easy in many countries to very radically reduce farm antibiotic use, because even though there's lots of intensive farming and that antibiotics are used to prop up a lot of intensive farming, while a lot of intensive farmers maybe don't fully realize is that they could still have an intensive farm and reduce their antibiotic use because they're overusing antibiotics so much. And Europe has proven this, because Europe has reduced its farm antibiotic use by over 50% on average, and it is still farming intensively. But that does mean that the pharmaceutical industry has lost in Europe over 50% of its sales of antibiotics, So that hasn't been good for them. Obviously, it's it's been good for farmers because they're spending less money on antibiotics. It's good for antibiotic resistance. It's good for
Brilliant.
society that, but
Yeah.
it's not good for the pharmaceutical industry to have their sales being reduced. And so, yeah, they continue to, um, effectively try and stop the setting of targets for reducing farm antibiotic use, claiming that targets are not scientific and this sort of thing. But
Yeah.
the truth is that when you look at the data, we clearly see that there are countries like the United States, for instance, per livestock unit is using over 6 times as many antibiotics as UK farmers.
Jesus.
Clearly,
That's
they can easily reduce their use by 30%, and they'll still be using 4 times or more than
yeah.
UK farmers. So it's just not an issue.
Yeah.
They
Wow.
obviously can reduce it by 30%, but they've lobbied against the 30% reduction, and
Yeah.
it's won out. So yeah, there's still
And
a
that
lot of work to do. Yeah.
that's after blowing my mind because I thought it was mostly because of the profit system of the intensive farming unit, and obviously the simplicity of poor in low hygiene,
Yeah.
um, poor quality food, cramped up spaces, no sunlight or
Yeah.
access to the outdoors. But you're saying even there, you can economically, there's an economic case that you can reduce that and still be able to have an economically viable business model that's
Yeah.
been proven
So yeah.
in
So
certain countries. And then, but on top of that, there's also the pharmaceutical industry weighing in, who also wants to make money off selling the antibiotics, and they're probably one of the lobby groups or industry groups that's pulling the levers more than I actually realized. I didn't, obviously, I knew that someone is buying, you have to buy the antibiotics somewhere, so somebody's profiting from it, but I never realized it was actually quite as large a push as, say, the actual intensive farming industry.
yeah, well, I mean, I
Wow.
think a lot of farmers would obviously, for many, many years, there was the advertising of antibiotics directly to farmers was permitted. So in the farming press, there would be a whole load of adverts from the pharmaceutical industry saying, if your animal has this problem, take this antibiotic, or if
Hmm.
or in the days when growth promotion was allowed, take this antibiotic because you'll get a bigger profit, it'll make your animals will grow faster, you'll make more money. So farmers that have been in the farming business for a long time haven't forgotten all of this. They know perfectly well that the pharmaceutical industry was telling them for years to use antibiotics because it was going to make them more profitable. So they also and because they haven't necessarily, before they reduce antibiotic use, they haven't reduced antibiotic use. They don't really know what's going to happen. They don't really know the full, what is the full effect that those antibiotics are having. How will their animals be if they cut
Mm.
antibiotic use by 50%? It's it's a step into the unknown. So there are
Yeah,
concerns there. Um,
gotcha.
but many countries now, throughout Europe have shown, they've maybe done it step by step because they had those concerns. So they haven't necessarily cut use by 50% in one year. But some of them, have cut use by 50% in maybe 3 years. So it's not as that, there
Yeah.
have been some really rapid reductions, some slower reductions, but even some of the really highest users of antibiotics in Europe, like Spain and Italy, have cut their use by over 50%. They're still very high users, but that just gives you an idea of just how a
Of
high
where
they
you're coming
were.
from. Yeah.
And as I say, the United States is using over 6 times more than the UK. That means if it reduces its per livestock unit, so that means if it cuts its use by 50%, it's still using more than 3 times more. So there is a huge amount of overuse.
Yeah.
Um, and in our view, we want, that in for many countries, that first 50% is actually, really quite easy. It's just a case of wanting to do it.
Yeah.
But then, there does come a point where you do have to start looking at your farming practices and your husbandry if you want to keep on reducing your antibiotic use. And
Hmm.
there's no doubt that, farmers, even non-organic farmers, say, that are, maybe like in Ireland, farming beef, out on pasture and that sort of thing, they
Yeah.
won't be using anywhere near the same levels of antibiotics as an intensive pig farm.
Yeah.
There's big differences, and there needs to be, in our view, we need to be reviewing those practices because, British pig farmers, they've cut their antibiotic use by maybe 70%, but it's, which is a lot, but it's still
Yeah.
4 times higher than in Sweden, per pig. So,
Yeah.
yeah.
Wow.
So,
Wow.
and K now is a relatively low, even in pig farming by European standards, it would be relatively low. Okay.
Where,
Uh,
UK, you mean?
yeah, yeah.
Yeah.
UK, even
Yeah.
though it's 4 times higher than in Sweden, by UK, by EU,
Wow.
we don't have antibiotic use for every country in pigs, but we have it
Yeah.
for a number of countries, and we kind of, based on the overall level across all species, we can kind of guess what it is in certain countries. And UK would be relatively low for pigs now.
Right.
There are quite a few countries that would be lower than it, but it's still 4 times higher than
Yeah.
um,
Yeah.
Sweden, and Sweden would still be significantly higher than organic, for example. So there's a huge amount of reductions that can be made, but UK farmers have not fundamentally changed their farming practices in the pig industry. Uh, there's a significant section of the pig industry in Britain that's not very intensive, but there's, the majority of it is fully intensive,
Yeah.
and it remains fully intensive, but they've still managed to reduce their use by 70%. And that
Yeah.
just gives you an idea of how much usage was before. So there's a vast amount of misuse of antibiotics globally. And I suppose if you also consider the global side, there's the really high use in countries like the United States and Canada, where they're massively intensive. Uh, but at least they have regulations. But then there are
Yeah.
parts of the world where there are no
There's one
regulations.
part of the world we haven't covered there, just below North America,
Yes, yes, yeah.
that it sounds like not all of those countries, but it sounds like there's a few or one in particular that isn't playing ball at all. And that's where we
Yeah.
were talking about disclosure. I don't know if that's been, I read that a long time ago, but I think Brazil doesn't really disclose much at all, right?
Well,
On
there are lots of
or has
countries,
that
yeah,
changed?
that there's significant amounts of intensive agriculture, and high levels of antibiotic use. Um, um, and yeah, so places like Brazil would have really high antibiotic use. Places like China has really high antibiotic
Oh,
use.
China.
They
Yeah.
have tried to reduce they have taken some initiatives, but China has an absolutely massive pig industry with, really high levels of antibiotic use. There are also, another concern with a lot of the world is that, a lot of the concern about the spread of resistance from farm animals to humans is via bacteria on the meat rather than antibiotics in the meat. So,
Right.
but that's because, in Europe, we have testing of the meat for residues of antibiotics. And in order to avoid having residues of antibiotics in the meat, farmers have to respect withdrawal periods. So they have to stop
Mm.
using the antibiotic a certain amount of time before the animal goes to slaughter, so that the antibiotic clears out of the
It's out
body
of
and
the system. Yeah, yeah,
still in the body. And then regulators will do kind of random testing of meat to make sure that farmers are, respecting these withdrawal periods. And sometimes, residues are found that are, above, sometimes way above legal limits. But the point
right.
is that generally speaking, farmers are respecting withdrawal limits, and so residues are not out of control. But in a lot of areas of the world, there's no testing,
Yeah, yeah,
and residues are completely, untested. Not only that, in some poorer countries, animal feed may have antibiotics and it's not even on the label. So the farmer buys the antibiotic, buys the feed, doesn't even know that there's antibiotic in it. Then so
In what
there's
in
no with
the grain or what is
well,
it?
in the feed, yeah. So they make
Oh,
compound feed
okay,
stuff
right.
that will
The
have,
concentrates stuff.
yes,
Yeah,
yeah, that will
yeah.
have antibiotics in it sometimes.
Jesus. Okay.
Um, uh, they won't necessarily have access to a vet who will tell them, about the withdrawal period or anything like that. It might not even be labeled,
Yeah.
and therefore it's not respected. And if you don't respect the withdrawal period, you end up with much higher levels of antibiotic residues. And so, in some countries, this will clearly be people will be eating antibiotic residues in their food on a much higher level than occurs in most European countries. So
Wow.
that's a significant issue. So even in some countries, maybe like in Africa, where they have on average less intensive agriculture, and in theory wouldn't be needing antibiotics nearly enough, and on average use lower levels of antibiotics in farming than in other continents. The problem is,
Mhm.
if it's not regulated properly, if even if there's lower levels of antibiotic use, if those antibiotics are being used in bad ways, whereby withdrawal periods are not being respected and that sort of thing, they may still
Mhm.
end up with higher levels of residues in food than we do in Europe, despite our higher use and more exposure
Yeah,
to the antibiotic. So that's on a global scale. That's an issue as well.
it's massive. And we're in quite a divided world at the moment, where, if you look at like climate change agreements or anything, even like the Ukraine-Russia war started off the idea that they could break away from the SWIFT system. Like we're look the financial system SWIFT. We're getting more to division rather than cooperation uh, at a time where we actually need to come together for these global issues, and we're getting more divided, um, not only because of wars on certain things, but also we're getting divided on the exact issues that we need to come together on, like biodiversity loss or whatever the vast array of things we need to actually cooperate on and find some kind of middle ground that we actually tackle these things properly and stay realistic about our, putting, say, ideals aside, and not this looking for a perfect world, but to just start moving the steps in the right direction. Um, it kind of it does concern me now that there are countries that aren't disclosing, that aren't coming to the table. Um, it gives me a bit of peace that the awareness is rising. The
Mm.
EU does sound like it's going in the right direction, and that it could be used as an exemplary thing to show the rest of the world, not in a showy offy way, but that it can be done. and inspiration can be taken from it, but it does concern me that we're getting more and more divided in these things, and even down to diets. Sorry, I know this is a kind of offside tangent, but I feel like we're when we're arguing about whether to be a meat eater or a vegan or whatever else, the division is rising. And something like antibiotics, which is a massive part of just welfare, that I think almost everyone I know could agree on, that animal welfare and intensive farming um, has gone down a very dark path that um, most people would like to tackle,
Mm.
or no, put it another way, there are meat eaters that look at intensive farming and say, "Oh, that's terrible," you know. But and my vision, this is idealistic, but to get everyone, no matter what diet, to agree that how factory farms are run is in not none of us want that, and that we could all come together on this thing where we're not just getting divided on meat or vegetarian or vegan, but rather that we can actually find
Mm.
common ground, that this is something that we could all agree on needs to be tackled for us, uh,
Yeah.
the animals and the environment. Do you, yeah, do you agree? Kind of, I don't know where I was
But
going with it. It wasn't a question really, but
yeah, I mean,
do
I
you
think there
see?
has, yeah, I think there has been some increased cooperation on tackling antimicrobial resistance in the sense that, as I mentioned, there has been just recently this second high level meeting declaration on antimicrobial resistance, and that has been the reason that that's been happening. It has been because there's increased global awareness, and there are lots of countries that do actually want to tackle it, um, and there are some actions happening. But yes, there's always been quite strong opposition as well, and that has been reflected in the sort of the weakness of the declaration. Certainly regarding farm antibiotic use. Um, but the fact that that the World Health Organization, the FAO, um, UNEP, and the World Organization for Animal Health have come together to try and tackle antimicrobial resistance, under sort of the UN banner, as it were, has been because there has been this attempt to sort of come together to try and achieve some sort of uh, minimum standards. And I would even say that a lot of the language, it is all about, talking about good husbandry and these sort of things, even though in practice it's not a lot of people kind of signing up to this language don't really mean it. So that's what I'm saying. Like, the EU regulations have some very good language, but what does that actually mean practice? And then on the sort of the meat eating versus veganism and vegetarianism and that sort of thing, then I mean, there are certainly people who will, openly say that they are in favor of intensive farming because ultimately it leads to cheaper meat, and that's what they want to see happening. But yes, I do think that generally speaking, a lot of meat eaters don't approve of it, and ultimately you know, that there is a role. I think there can be a positive environmental role for livestock as part of kind of a mixed farming system. But when meat becomes such a huge part of the system, and that the role that livestock can play becomes divorced from the rest of farming, and essentially it's just a specialization in highly intensive meat production, then it's not really producing any kind of, or very few environmental benefits. It's causing quite a lot of environmental harm. It's obviously causing a lot of animal welfare harm, and ultimately, it looks bad for the whole of livestock farming and for meat farming, and all livestock farming then gets tarred with the same brush, and meat eating gets tarred with the same brush, and then the response is, to go vegan or to promote veganism, and so there's no consideration of the possible, ways in which it could be done in a more ethical and sustainable way, and because there are genuine concerns that, okay, if we get rid of all farm animals, okay, how do you farm? Well, you farm no longer with manure, you farm entirely through chemicals, and once you farm entirely with um, fertilizer, artificial fertilizer, then you need more use of fungicides and pesticides and all these sorts of things, which are having their own environmental impact. The reality is, pesticides, insecticides exist for one thing, and that is to kill the pests, to kill animals. Now, pesticides, insecticides, they're all part of veganism, but I think, what I mean by they're part of veganism is not necessarily that vegans endorse them, but the fact is that is how most vegan food is produced. And the question then is, well, is that right? So is there a way of farming without the use of all these chemicals? And I would argue that one way is by having low levels of livestock that are bringing in positive nutrients into the farming system via a rotational
regenerative stuff.
And there may be ways of doing this entirely vegan as well, but those need to be examined and developed, and they do not exist on a large scale at all yet. And what really exists in terms of non-livestock farming is large-scale intensive, chemical-based farming, which depletes soil, which doesn't get considered much in the discussions around carbon emissions and that sort of thing. You need to also consider the health of the soil.
You're nailing it.
So there are many other issues. I mean, this falls slightly outside of my area, but I do think that it is true that large scale intensive farming, or intensive farming rather, is gives all sort of livestock farming a bad name, and then the conclusion that a lot of people, including a lot of scientists, draw is we must get rid of livestock farming. It's harming the planet, which it is. It's harming antibiotics. It's not doing us any good. It's harming our health in many ways, with people eating too much of these stuff and putting on weight and that sort of thing. So let's just go vegan. So there is that and there can be a role also. Well, I mean, that's not the Alliance to Save Our Antibiotics. We don't take a position in favor or against veganism, but at the same time, we're not also campaigning for an end to all livestock farming. We're sort of campaigning for major changes.
I think that's a very smart stance as well, because then doors around you don't close for, you're talking about the one issue, and then the rest of the world, how it develops. It's better. It's the best position you can actually take, is to not be all guns blazing one way or another, but to just be you're doing your side, and letting the other part kind of evolve all by itself, where you can have a reasonable discussion with all people. See, this is where when I think about the type of work you do, you actually have to be very, you have to move away from idealism and go straight to realism and be pragmatic about how to approach these things. And I love that you said that about um, like the nuance of it, that it's not black and white, that
Mm.
there's more environmentally friendly ways to farm livestock, and through regenerative agriculture, and also that I'm not bashing veganism, and let me not ever stand in the way of anyone going vegan. Um, I would kind of point to the idea of the chemical farming that it has massive implications from the GMO, the pesticides, the fertilizers, the pollution of the water, and the GMO crops developing resistance to pesticides. So you use more of the stuff in the long term. Um, there's a way to have vegan food that is environmentally friendly, and there's a big question mark over where our food production systems are evolving to.
Mm.
And right now, from what I see, the like the intensive agriculture on livestock, and how other crop foods are produced are environmentally damaging. So you're either or, it's bad. And there's a sustainable way to do these things, and there's a very impactful way in a negative way to do these diets too. And that's the nuance that I'd like to kind of zone in on, and where we can find common ground. Um, yeah. So, hey, I agree with you. Thank
Yeah.
you. Thank you. You know, it's so refreshing is to hear like realistic, pragmatic views on these things, and not this tribal stuff where, we're getting further away from talking to one another. And,
Mm.
even if it's, hey, I have lots of friends that I really like, but I only agree with them on probably 80% of the stuff, and we're divided on 20% of the stuff. But I still love them. They're great people. And I think the idea that we can kind of communicate with one another and have thoughtful disagreement about things is the way forward. And it's also, and it was, I was in Germany lately, and I lived there for 10 years, and I was talking to my friends there about just what it means to be in a democracy, that we can talk about these things reasonably and not, you know, like debate things through and through rather than pouncing on one another, because like we learn through all these discussions,
Mm.
um, the
Yeah.
smarter angles. I can learn from you. You probably can't learn from me, but you can learn from other people. But it's I think your voice is really refreshing in this topic, and it's like our last two discussions have also just kind of confirmed things that would have been floating around in my head about antibiotics or the future of agriculture. And um, I commend your work. That's why I hunted you down. I didn't say this at the start, but when I was doing the research for the antibiotics chapter, it was your report on routine dosing in the EU that knocked my socks off. Yeah, I really thought, wow, this guy has nailed this stuff, and really knows what he's talking about, and kind of has boxed out all angles. Um, yeah, so well done, and I hope you keep doing the good work you're doing. And I hope from this discussion, whoever listens to it or watches it, that realizes the gravity of the situation, that we do need to get ahead of this stuff, and how it impacts all of us, the environment, animals, and people, and that hopefully we can all come together and push this forward in a positive, meaningful way. And yeah, that's it from my side. I
Okay.
really,
Yeah.
really appreciate the
Yeah.
conversation, Colleen.
Well, thanks.
Thanks.
Yeah. Well, thanks very much, Chris, for getting in
And
contact. Yeah. Yeah.
keep up the good work. And
You too.
I
Yeah.
hope the supermarkets initiative works out well for you.
Yeah. Okay.
And
Thanks. Thanks a lot.
maybe we'll be in touch soon
Yeah.
again.
Okay.
Take
Thanks.
care. Thanks very much,
Thanks.
Colleen.
Bye.
Take care. Bye bye. Yeah.